Partner Nzili and Submi Advocates. Thank you, ladies, for staying with us as we continue with this conversation. Professor Catherine, how would you distinguish then the difference between just having a challenging time and going through a mental health issue because of what is happening in a workplace? Because some would say, look, I am just tired because things have gotten hard. But then you also have somebody who's really been affected and their mental health is deteriorating because of a series of things that have happened at the workplace. How do you distinguish between the two?
When you're going through a tough moment, it can be you're having deadlines that you need to meet, or there is something that has happened because maybe you have lost one of the employees and it's basically a difficult moment. Something has happened. But when people are going through mental health difficulties or they are suffering mental illnesses, then you see the symptoms. You see the symptoms in the sense that one is feeling hopeless and helpless, is not able to engage with work the way they always do or they have always done before, or someone is keeping on crying. You cannot understand the reason as to why you are tearing, you are crying, or you feel like you have disconnected with work, you do not have motivation for work, and you have started using like drugs or even beer or whatever drug of choice that you take on board. And you know it's different now. You're becoming irritable and you're bitter, you're angry, you're shouting, you know. And you're saying, it's not like me. And other people or other employees in your division or section are saying, it's not like you. What is happening? And you want to sleep and you don't want to bathe and you do not want to be with friends. It's getting difficult at the relational level, getting difficult in terms of the outputs, getting difficult emotionally. You're not feeling like you're one piece. You're feeling like you're disconnected with yourself. You're fragmented. You cannot tell who you have become, but you have become something that is a stranger to you. Because again, you're losing your humanness and your own abilities. So having a difficult moment is so different from when you're suffering a mental health illness, whether that is going to be anxiety or it is like depression or it is psychosis. It is different. The way I'm listening, I'm not listening the way I used to do before because I am having a psychotic episode or season, or maybe even hallucinations. I am seeing and hearing things that are not there. And my friends, colleagues are saying, no, we have not heard that and we have not seen that and we have not thought about it in that way. There may be something that is happening to you. So there is a whole transformation that happens to this individual who is going through a mental health illness.
So a completely significant change in this person that you used to know.
Yeah.
And you realize this is not the same person. Their actions, how they act, what they do, what they say is completely different from who we know, right? So Esther, when you look at that, but there's still so much stigma that surrounds mental health, you know, conversations, and especially even in workplaces. This is a discussion that we continue having, but not many people are willing to discuss it in public to say, look, man, I'm diagnosed with depression or I have bipolar, you know, and all these things, because there's still that stigma attached to it. So then how can organizations create an environment where people can safely say that I am not okay and, you know, I want to continue working, and give me the resources to be able to perform as I tackle this issue?
Great. I think it's important that this conversation around mental wellness begins from the top. You see, I know most people have said, you know, it sits with HR. But I want to say, I think it should start from the top. If the CEO comes and says, I think we need to have a conversation with you, you know, we need to have this conversation, normalize mental wellness conversations in the workplace. And it's not just saying, I want to sit with you, I see like you have a problem, you know. It's checking on you, you know, how are you doing? How is your family? And very rarely do you find people asking you, how have you been? How is your family? You know, as Catherine says, checking on how you, where you've come from, how you came. It's the performance. It's this and this, you know. Can we just go beyond the performance? Let's go beyond the sales, the targets, and just know that we are dealing with a human being. Normalize this, have programs within the workplace. And I have seen organizations that decide, at this time we take a break. You know, we have this conversation, we talk. Managers need to understand their team members. I need to know you so well that I can tell when things are not right.
Right.
I need to interact with you so well. I just don't need to push you for results, you know. I need to have the coffee or just take a walk with you. What is so hard about taking a walk with a team member if you can? Or just holding online conversations, you know, bringing in speakers like Catherine that will just help us normalize this conversation. It's not as complicated as we think. I think we need to simplify this conversation. And I've always said that mental wellness conversations are no longer nice to have in the workplace. They are must have. We need to make sure that we are having this conversation. We need to bring it down from the top. It should come down to the managers, come to the supervisors, and all the way to the bottom. Because the impact of mental wellness on the cleaner affects the entire organization. On the security guard, affects the entire organization. If I'm mishandled at the entry because the security guard has an issue, it's affecting the entire business. So can we normalize this conversation?
So does it come to the issue of providing those resources and creating those programs for, you know, employees and other staff to be able to, you know, engage and help themselves?
Yes, I keep saying, you see, when you're having your budget lines, planning for salaries and many other things, can we have a budget line now for mental wellness, which is very rare in most organizations? Can we have a budget, you know, where we will have the talks, we will have people go for counseling, we will support